If we want trauma to be a responsibility of pediatricians, I don't think we can do a trauma course for pediatricians. I think we need to figure out how to embed trauma, trauma awareness, trauma understanding with everything that they do. I mean, it needs to start with understanding that if a kid is in the ICU and they come out of the ICU, they need to understand that trauma was a part of that process. And it could be the kid is resilient and there's no need for any intervention, but just that initial awareness that trauma is a piece of that experience, an infectious and cardiovascular process. I think we need to talk about that. I think we need to talk about how trauma is a part of the accidents that occur and bring kids into the ED. I think we need to talk about how when we're talking about mental health in pediatrics, we really do need to be thinking about a trauma-informed pediatric approach. And that's just different than thinking about, the most common things to diagnose in kids are ADHD, depression, anxiety, and trauma. Like, no. I'd rather them think about, from a trauma-informed perspective, how to go about assessing a child in a pediatric setting. So that's the point. I think, we can't relegate trauma to yet another pathology. It's a life experience, and it's a contextual way to understand the child. And if we're going to be effective, however they decide to educate the next generation of medical students and pediatricians, if we interweave trauma and an understanding of trauma throughout medicine, I think it can actually impact how pediatricians respond to kids.